So I'm here with someone who I would love to introduce to you guys. This is my pelvic floor specialist, PT, Jessica Dorrington. I started seeing her after I gave birth to Stanley, and she has helped me tremendously come back from getting birth. And I wouldn't be able to run or do what I'm doing right now with any sort of health without her. So I would love to share some of her knowledge with you guys, just give you a little bit of a base into what has helped me come back from pregnancy.
Okay. And just for my background, I am a pelvic health physical therapist, orthopedic board certified, but then decided to specialize in pelvic health because I realized what it does to help women and men understand their cores and get back to doing what they love to do. So Gwen, we know that when you have a baby, you're planning your nursery, you're figuring out all this stuff, you're trying to figure out what the best stroller is and the best wrap and all of those things. And it just seems like all this planning and hype happens, and then delivery happens, right? It's like delivery is the finish line, and I think maybe it should be the start line. So it was an honor to be able to kind of sit with you and say, hey, we want to give people the understanding and kind of the tools at the start line, which is actually right when baby's here, and we go, what's our plan going to be like to get back our body, get back our core, and kind of get back into doing the things we want to do?
Yeah, I think that's great. And, talking about that starting line, it was, for me, something I thought I'd give birth and I thought it'd be over. But like you said, it's not. That's just the beginning. And, even myself, I don't have a lot of regrets in my life. But one thing, if I could do it all again, one thing I would do differently is see you before birth. Yeah. Because before birth, I know there's a couple things you can do to make that birthing process actually a little bit easier and better.
Yeah, and I think that's even orthopedic PTs don't even know what a pelvic floor therapist does. They don't know that we can actually help you deliver and help you train how to push properly. We can figure out what positions are best for you and kind of your birthing preference plan. And also during the exercise portion, really help you guide where it's safe and how much volume you should be doing and what exercise is safe during pregnancy and what's okay to let go and let your body be a construction zone a little bit for a while.
Yeah, I think, two things I've talked to you about is, one, the birthing position you can be in and how we're all built differently and how our pelvises are kind of tilted in different ways, and there may be a position that I could have been in during the birthing process that might have made it easier for Stanley to have come out. So I think that's something that is really interesting that maybe a lot of people in the general public wouldn't know about.
Yeah, and if Stanley ever wants a sibling, we'll definitely go through that for the next one.
Oh, yes. The other thing I think I really learned from you is those exercises and what is safe to do and what's not safe to do, especially as an athlete. I always want to do more. And I did quite a bit, I would say, while I was pregnant. I was able to do it, injury-free relatively, and I was cycling, running, swimming still, and for a while I was doing a lot of core, and I felt like I started to have some of that diastasis rectus form, and I'd love you to touch on maybe some of that, and maybe some core things maybe you should hold off on, or what's something somebody should maybe pull back on.
Yeah, and that's a little variable per person. But the diastasis or diastasis that we call it, take that back. You say diastasis, I say diastases.
Yep.
And but 75% of women actually get that. And
that's a lot.
We can get that with having babies. We can get that if we just have more weight around the middle. We can even get that if we're, an athlete who's really pushing and trying to doing a lot of heavy lifting and Valsalva maneuvers. And so that diastasis or diastases, the biggest thing is if you are doing any exercise when you're pregnant and you see kind of a bulge or, kind of that, we call it a tenting, that means that we probably need to work less on those big outer muscles and more on the inner core muscles.
Yeah.
And, we talked about kind of what is core. I think people don't understand what core is. Core is, we've got inner muscles and we've got outer muscles. And everybody knows how to train the outer muscles. We know how to train our six-pack abs. We know how to train our obliques. But we don't know how to do is train the inner ones. And the inner ones are our foundation.
Yeah.
They're our core. They're really, you have got to have that solid foundation before you build your house.
Yep.
And those inner ones, you'll never go wrong by training them most often, as long as you're not having pelvic pain or other things that could tell you those muscles might not be functioning either. So
perfect.
I think, I'm not sure what you're getting for your post feeds, but I know the common questions that we get all the time are, what core exercises are safe? What core exercises can I do? How am I ever going to look the same is often a question, right? Yep. We have our post baby bodies, and we want to know, what's that going to be like? And then the other questions we get that are less often asked but kind of secretly asked is, how do I stop leaking when I'm after baby, or even sometimes even if I haven't had a baby? Or how do I get that pain down there to go away? And those are such common questions that I think we can answer today to help people really understand.
Yeah, and I would love to talk about that too, because I think there's a misconception that you just have to deal with that after baby, and that's not the case.
Yeah.
If you see a physio, a pelvic floor PT, it's something that can help you get your body back and start feeling normal and not have that pain and stop that leakage and things like that.
My favorite story is a 96-year-old woman I saw for low back pain. And we'll talk in a minute about how low back pain and kind of the pelvic floor are all connected. And I asked her, I said, do you have any leakage? She's like, oh, honey, of course. And after 96 years, she left the clinic, no incontinence.
Wow.
And so it just goes to show, your grandma telling your mom, saying, well, that's just got to be the way it's got to be. And your mom telling you, you kind of that same thing. That isn't the case. Yeah. And we really can fix these things.
It's exciting.
So we realize that everybody wants the magic 10 exercises, right? Everybody's like, just give me those 10 exercises that'll help my core.
If it was that easy, though,
right?
Everyone would know them.
We'd have, it would be plastered all over the web, I'm sure, right? But what we realize is knowledge is power. And I think the more you've gone through this, the more you realize, the more knowledge we can give people, the more they're going to understand what core is, what their core is, and they'll have the tools to actually navigate. So
right, because everything is so individualistic, and if you can kind of understand everything that's going on, then you can maybe figure out, what is best for you, because what's best for me might not be best for you, and I think that's really important to know.
Yeah. Now, we tried to group it into at least 3 simple categories for people today, so hopefully we'll hear those 3 simple categories and people can start to understand and really figure out which group they should at least start with. And going to a physio, nothing's going to be superior to that, but it's a great place to start. So before we dive into core, it'd probably be good for everybody just to hear kind of your perspective of what it was like going through it.
Yeah, I think, coming back from giving birth, I thought, I'll take 5 days off and I'll be fine. I can just do everything. And in reality, I was basically laying in bed for 2 weeks. I was bringing my donut that I was sitting on out to dinner. There was just so many things that were not what I thought it was going to be. And I think that was a really good reality check right away, just being forced into seeing what a difference it is versus what I expected. And, for me, I thought, okay, first thing I want to do is I want to get my stomach back. I want to get that 6-pack. I want it to all look good. And I realized as I started working through it that wasn't what the issue was. I still had good brute force strength, but there were some muscles in there that weren't firing, and I needed to learn what those were and how to fire them and how to get those inner core muscles kind of working properly so that it could support my entire body.
Yeah. They're important, those inner core muscles, especially when we've gone through delivery, but even for our triathlon, individuals who, let's say, have lost 100 pounds. They're doing great and they're finishing their first race and they're losing weight. The same applies to them, right? Because these abdominal muscles are overstretched. And we've even seen, those abdominal muscles when they're perfectly functioning. And we see them on the ultrasound machine that we've used in the clinic. And when someone is out to here, ready to give birth, we can watch, and those muscles actually aren't even firing anymore. So it's important for that muscle to kind of learn how to find where it needs to be again.
That diagnostic ultrasound that you're talking about was so cool. I'd never really seen something like that before. So Jess would hook me up just like a kind of a regular ultrasound, but you could see the muscles in there, and she'd ask me to, squeeze this or squeeze that and, tighten this muscle, and we could actually see it. Was what my brain was doing, was that the same thing that my muscles were actually doing. And so I think, everyone can benefit from that sort of thing, seeing a pelvic floor specialist, even if you haven't had a kid, to see, do you have those muscles firing in the right way to help you perform to the best of your ability.
It really helps cut down kind of the guesswork of saying like, oh, I think I'm contracting my core
Yes.
right. And helps it really fine tune and say, okay, this is where we need to be.
Yeah.
So, yeah, good. So let's talk a little bit about the core and how a PT or a physio looks at the core. The core is really, this pop can, we call it, or soda can, depending on where you are in the country, I suppose. And we look at this area and we say you have your diaphragm on top, which does your breathing. You have your pelvic floor muscles or Kegel muscles on the bottom. And then we have these ab and back muscles that go around it. Now the ab muscle that goes around, there's one that kind of looks like a back brace built out of muscles. It actually even dives underneath that diastasis or diastases you're talking about to help it transfer load. And that's our inner core. They stabilize us. But then the outer core are our six-pack abs and our oblique muscles, and they get really stretched out with baby, right? And so we've got to have the inner core muscles stabilized, because then I can use my power to run, I can use my power to do my movements, lift my baby, do whatever I want to do, as long as those are stabilizing first. If I just clench my stomach, and I think most postpartum moms, right, we want to suck it in and hold it in because we're like, this looks different, yeah. I know I need to stabilize. But if we're pulling that in too much and we use our big oblique muscles, then when you go to rotate, that muscle that rotates is only your obliques. So they have to let go and say, okay, this is my primary job. I'm going to go rotate, but then your spine and your back and your pelvis are left without anything to stabilize them. And that's where we can get into injury and lose some of our power and our athletic ability.
Yeah, I know for me I had some lower back tension, and that was a lot because I wasn't having some of my inner core really tightening, and I needed to work on just those muscles inside and relearn how to activate them, because the inner core is something I've learned is it's an automatic thing. So it's like you have to bring that automation into it. So, every day I was doing these little tiny exercises that didn't feel like anything. But I had to reteach my body to activate those muscles that had shut off. And then once they turn on, you don't even need to think about it. Then you can go for a run and you are using the right muscles. And, so it's really positive thing in the end, but you need to learn how to get there the correct way.
Yeah. I always say it's kind of like driving a car. After baby or after even back injury, sometimes those muscles shut off, those inner core ones, and so now you're driving around a stick shift.
Yeah.
So you can still contract them, but you have to do it before you do the movement, because normally they should turn on. If you think about lifting Stanley, as soon as you think about lifting it, your brain actually activates some of those muscles, tightens your core without you even thinking about it. And people experience that mostly when you think about somebody who doesn't have any leakage, right? If I go stand up out of a chair, those muscles turned on for me. I didn't have to think about it. And then after baby, sometimes it's like, ooh, those muscles didn't work for me. So good. So we talk about this area as a pop can. And pop cans are pressurized, right? And you can imagine you put a baby inside of that or extra weight. And all of a sudden, that can create that diastasis we're talking about. It can put pressure on our bladder. It elevates our ribs. And so it changes that pressure system. And that pressure system is really what we're trying to work on. And so out of that pop can, if we have any slits in a pop can, you can imagine it's going to be harder to stabilize. So that diastasis, as it opens up, that's going to be harder to transfer load. Or if we have any pelvic lacerations, during our delivery process, if we have hernial repairs or back surgeries, C-sections, all of those types of things are going to influence how we're transferring that load. And it just brings us back to learning that we have to train the inner core muscles.
Yes, I'm all for that.
Yeah, good. So I think we should teach people how to kind of contract those muscles. And so we're going to start with kind of the inner core muscles. And if you want to put your hands on your hips, we can kind of guide everybody on how to do it. The first thing in order to really access that transverse abdominis, or that back brace muscle, is to really relax your belly. So belly has to be relaxed. You're going to take a breath in, and then as you exhale, you're going to pull your two hip bones together, or your two hands together. You should just feel kind of like that triangle down here contracting a little bit. And if you know you're doing too much, remember that's that cue if these fingers start to pop this way.
Yeah, I think that was a big one for me. I always thought more is better, more is better. If you can make it tighter, that's great. So I would be doing these transverse abdominal exercises where I'm activating, and I could feel them pop out, like really a lot, and I'd come in and Jess would be like, no, we do not want to do it that much. So like the athlete in you has to kind of hold back a little bit when you do these.
And as the athlete in you, how did you wrap your mind around, I have to do these measly little exercises when all I want to do is like get back into the gym and do stuff that I know is making a difference? Yeah,
I mean, that's hard because working on things like activating the transverse, which is something that Jess and I worked on for weeks and weeks and weeks, months. I'd lay down or sit down and I would just activate it, and it doesn't even look like I'm doing anything. I could do it watching TV. I could, you're not getting your heart rate up. You're not getting a workout in. But for me, I think what kept me motivated was knowing that I couldn't go out and do those workouts where I'm getting intense and like getting my heart rate up without going back to the basics. You need that basic. You need that foundation. You need that core to be stable. Otherwise, you're just going to get injured in the long run. You're going to have to take more time off. So I think that's what really kept me motivated, was knowing if I can get this inner core working, I can stay injury-free and progress.
Yeah. And good thing it happens fast. You know, the more, I always say it's like practicing a piano. The more you practice chopsticks, the faster it's going to do. Yep. So you can't do these too much. We're going to show you how to do them in kind of all your daily movements, and lifting Stanley and doing all those things in a few minutes. But the more you can practice it, the more that body just kind of has that muscle memory. Yeah. Just like after you've taken some time off running and you're heading back out on the road.
Yeah, and it is amazing how quickly it works. I remember, the first time when we used the diagnostic ultrasound, and my transverse, I'd lift my arm and it wouldn't activate, and just a few weeks later, if I lifted my head, they would activate, but maybe not when I lifted my leg. So it caught on pretty quickly, but you do have to work on it, and it is a little mindless at times, but at the same time, you really have to think about it. So it's something that is really important, and you just got to put your head down and do it.
Yeah. And luckily, we're going to do them with baby movements and lifting babies. Yes. So it's not quite as much time during the day. Right. It's not a whole nother set of exercises you have to do, because moms, we know, have a hard time even showering those first few weeks. It's like, oh, how did a day go by and I didn't even shower? So
exactly, yeah. We work on it, when you change a diaper, or when you put baby down, or when you hold baby to feed them, or whatever it is, you can work on it.
Yeah, that's great. So let's talk next, after the transverse abdominis. We also have another muscle that's part of our inner core, and that's the pelvic floor. It's the bottom of the pop can, so to speak. And the pelvic floor, most people know if you do a Kegel, it's supposed to help with not leaking or stress or urinary incontinence. But what other people don't know is the pelvic floor actually has 5 roles. That's a lot.
Yeah. And it's shocking too, because I think even when you're going through pregnancy, everyone knows Kegel. Everyone knows that word, and everyone thinks, all I have to do is a Kegel. Right. But the way you do a Kegel is very different, I think, than what maybe the general public thinks.
Yeah, absolutely. And that Kegel, we're going to explain how to do that for both men and women, because it's actually different for both people. For men, it's kind of thinking about lifting kind of the making the penis shorter, or it's also kind of thinking about you're going in some cold water and don't want to dip into the water too much. But for women, we want to actually contract the rectum first, or think about closing kind of the rectal opening. And so it's different cues for different people. Yeah. And hopefully what we walk through for people to know how to do that contraction, if they can't figure it out, they should consult a physio, because believe it or not, 25% of people can't get it through verbal instruction. Wow. And so just by reading it online, or seeing a video like this, they may not be able to kind of get that sense of what those muscles are. Yeah. So, the pelvic floor, in terms of its 5 functions, so we know it has stress incontinence function, or kind of closing those sphincters. It takes the urethra and where the bowels are coming out and kind of clamps them off. But it also has sexual function. And because it attaches from our pubic bone all the way around to our tailbone, it actually stabilizes our back. And then the 4th function, it kind of holds everything up. Holds the, all the organs inside, so your bowels and your uterus and your bladder. It has to help hold everything. And then lastly, it clears out some lymphatics. So
it has a lot of jobs.
Right? It does. So I always tell people, if you're having back pain, that could be a signifier that it's not operating in the other functions. Or if you have incontinence and low back pain, it's kind of showing you that the pelvic floor may be kind of at the root of this, and we need to assess the internal kind of core function.
Yeah.
So we know that if it's not operating in one part, it might not be doing the other. And I always tell people, this area, if you're getting some leakage, it's more than the core can handle. And so do you want to talk a little bit about your experience of kind of seeing where your core was at?
Yeah, out of those 5 functions of the pelvic floor, for me, one area that I did have some trouble with when I came back to running was some leakage.
Yeah.
And it was happening, I would say, on harder runs for me when the body was fatigued. And, initially I was like, oh, it's no big deal. And I remember then I came in and talked to you about it, and we looked at it, and, it was, my pelvic floor was weak, and we needed to work on, how we could activate those muscles. There was just getting too much pressure and too much, I didn't have the right muscles working, and so it was causing some leakage.
Yeah. And then cleared up pretty fast with just
did.
Doing some exercises.
It was very quick. It was
Good.
like 2 or 3 weeks of exercises, and it had cleared completely, which is pretty amazing.
Which is great. So we've tried to make this easy, because you can only know so much about core without actually having a full assessment done. But one of the first kind of categories of types of core that there might be is just a weak pelvic floor and a weak core, and that's those internal core muscles. And that's somebody who might just be having a little stress incontinence, right at postpartum might be having some issues, and really just need to kind of learn the exercises we've talked about, how to contract that transverse abdominis and contract the pelvic floor, and do more of those activating throughout the day.
That's perfect. And what are the other 2 areas?
Yeah, the other 2 areas, the second type of core is the one that maybe they've been running for 2 to 3 years with incontinence, or they're always worried about leaking and kind of holding those muscles in. Or there may be somebody who's never had leakage, but they've just always had pain with intercourse, or pain with, going to their exams with their gynecologist. They might have other types of pain, like they're sitting on their triathlon bike and saying, why am I getting pain here all the time? And that's a muscle system that actually needs to do something different. It needs to relax. We need to do less strengthening and more kind of relaxation of the system, more stretching of those muscles.
And I think that's why it's so important to see a pelvic floor specialist, because you don't really know. You may have the same symptoms, but that's maybe coming from different causes. You may have pelvic floor that's too weak, one that's too strong and holding on, or the third one.
Or the third one is actually just somebody who's got that good internal core, but they don't have a good external core. Yep. And they're the one, on the ultrasound machine, we see their core contracting for them, and they just really need to strengthen their 6-pack abs and their oblique muscles.
That's what we all want to do.
Right? That's where we all want to be, but unfortunately that's where most of us aren't, is we fall somewhere in the other 2 categories.
That's perfect. So what are maybe, out of those 3 categories, can we give one exercise? Maybe we'll go through one exercise that somebody could do out of each of those categories. If you can kind of figure out, which category you're in, then maybe you could do this one exercise and then see where you go from there.
Yeah, that sounds great. So the first one is just that weak core. Yeah. And the weak core, you really want to think about the bottom of the pop can, which is the pelvic floor that we talked about how to contract, and think about that transverse abdominis or back brace muscle. And unfortunately, you have to coordinate the 2 of them together, and you have to not hold your breath. So we've got to do a little bit of rub your head and pat your belly all at the same time. So let's walk through that and teach them how to activate those. So you're going to take a breath in. As you exhale, you're going to tighten the Kegel muscle or the pelvic floor, pull in those 2 hip bones slightly as the breath is happening, and then you're going to do your movement. So we call it blow as you go, or kind of make sure you're exhaling as you're moving, or you're lifting your baby or lifting your weights at the gym, and that really helps with that.
And it's a lot harder, I think, than it sounds. This is something that I worked on. This is the area that I had to work on, and coordinating with the Kegel, closing the rectum, then kind of like bringing the entire Kegel up, and you can almost do it in like 3 different ways, phases. Like phases, like you're lifting a marble or something as well. So doing that and activating the transverse, but not activating it too much, and breathing and doing an exercise. I mean, it takes a while, and I think that a lot of times you just start with just activating, and then you work on to doing the activation and then an exercise. Yeah.
And if you're postpartum, it's great. You've got a lot of time nursing.
Yes.
And so I would say that's a good time to do it. You're sitting there, you can be nursing in whatever position's comfortable. Do your breathe in, relax, breathe out, tighten those two systems, and just lift a leg or just lift an arm and just get that muscle memory to start happening.
Yeah, that's perfect. So then maybe for the second group, if you're too tight, what's maybe an exercise that somebody could do?
Yeah. So if your muscles are too tight, they also can actually become weak. And the best way I describe this is, think about your biceps. And if my biceps is always contracted, I can't lift anything, right?
Yeah.
But I can relax my biceps. And now all of a sudden my muscle has the right length tension ratio and it goes and lifts. And so it really is about having the muscles in the right length to be able to use them the best. And so let's actually go over to the mat. We'll meet at the mat, and then we'll be able to kind of teach them how to relax.
Perfect.
Good. So Gwen, this is an exercise that's for people who their core has gotten tight and has actually even probably gotten weak as well.
Yep.
And so we know that the adductor muscles kind of have some fascial attachments to the pelvic floor. When you really have to pee, you know what you do, right? You kind of tighten these muscles. So we're going to try and stretch the inner thigh muscle as well as stretching the bottom of that pop can. And you're going to use your breath to do that. So I'm going to have you spread your knees just a little bit further apart. And you're going to come down into a child's pose position. And if you want to take one hand and reach it back, you can find kind of the area where the bowels come out. Mm-hmm. That's where your pelvic floor muscles are. And what you're going to do is really let your belly hang so that your core is relaxed. You can see you wanted to contract your obliques. Mm-hmm. You're going to let that belly hang, and as you take a breath in, let your belly drop down to the ground and feel this area moving backward and outward. And just doing 2 to 3 minutes of stretching like this, especially if after you've done a heavy workout, maybe you've been on the bike, maybe you've been for a long run, or even at the end of the day, can really help to relax those muscles.
Perfect.
So this is where if we just need to kind of strengthen those big mover muscles, right? The ones that are really powering us through when we're running and doing a lot of our lifting and movements.
Yep.
They already have a good internal core, and now they just need to focus on their external core. So I'm going to have you lie down on your back. You'll probably remember this exercise because you're here already. Now remember, for our ribs, we want to drop our ribs down towards our belly button just an inch. Because those ribs, as babies, we've been here, those ribs can elevate up to about 2 inches. So really kind of finding that breastbone and just dropping it down about 2 inches, or dropping it down towards the belly button. You're going to keep your back flat on the ground, and then you're going to bring both knees up here. From this position, you'll start, just to be easy, taking and dropping one heel down to the ground, keeping that back flat, and bringing it back up.
Yep, and I remember when I did this, using my hands down here to make sure that my back wasn't arching.
Arching, yeah. And then as it gets harder, or this exercise gets too easy, and you want to make it more difficult, you can take and reduce how much your knee is bending, and now you have to bring a longer lever arm down to the ground, still keeping that back flat and those ribs nice and soft down towards the belly button. If you want to make it more running specific, you can start to move a little bit faster, because it's not just about core strength, but it's more about how can those muscles actually function when they're, running at 90 times a minute for cadence on one side. Okay, so Gwen, we went through kind of an exercise for each one of the categories, and it's always safe to start with categories 1 and 2, meaning just learning how to activate those muscles, learning how to relax those muscles before you move into the last and final, just working on the outer core muscles.
Perfect.
Yeah. Now, in terms of your program, how do you feel like it has helped you?
I've been so, vocal, and I've really wanted to share this with so many people because it has helped me tremendously.
Yeah.
I really thought I'd be able to have a kid and come right back, and that wasn't true. And once I realized that, I thought, oh man, am I ever going to be the same? And I think it's a misconception that you will never be the same, because I think you can get back there, and I think you can even get stronger.
And now you're PRing,
which
is amazing. So congrats.
Thanks.
Which is awesome.
Yes, I'm running faster than I ever have. So I think it is important to kind of go back to those basics after you've had a baby and see how that can help. So I know this has been kind of like a brief introduction of pelvic floor, and it's been such a big overarching view of just maybe this, that, and this is kind of what can happen. But the most important thing, I think, is to see a pelvic floor specialist. And so can you kind of maybe, you're in Portland, but what if somebody's not in Portland? Who can they see, or how can they find someone?
Yeah, so this is definitely a 30,000-foot view of what pelvic health has to offer. And I've been doing this almost 2 decades. And to see our profession really move has been awesome. But there is so much more than just even the muscles. So it's important to go see a pelvic floor physio, because if it's not the muscles, there could be other things where there's things happening with your bladder or with your bowels or with other systems that they can really check out and kind of get you steered in the right path.
Yeah.
If you're not in Portland, which most people are not, there's 2 amazing websites. One of them is called the APTA, it's the American Physical Therapy Association, and they have a practitioners directory. There's also another group called Herman and Wallace, and they have a practitioners directory as well. The last thing is you can always reach out to an ortho physical therapist around you, because they
That's
usually
how I got in
have
contact with you.
Yeah, right. They usually have a good, kind of person in their back pocket of like, this is who I know who specializes in this. So, and you can even reach out to your urologists, your colorectal specialists, your OBGYNs, because they also understand how the pelvic floor works in their systems. So reaching out to any one of those medical practitioners should help land you in the right space.
Yeah, that's perfect. I mean, there's just so many ways to get in touch, and I hope that people go out there and find someone.
Yeah, which is great. And I would love to hear more of where we should go next. There's so much we can focus on and so many different avenues of core. So I'd love to hear if people feel like they're more just that weak core and want to have a more detailed program on that. If they feel like they are that kind of overly tight, I've done too many planks and done such great work on the outer muscles that maybe I need to learn how to relax the system a little bit. Or if they feel like my core is great, just give me the next kind of outer core routine that's going to help drive athletic performance, so we know where we should go.
Yes, so if you guys have any opinions on that, we'd love for you to leave some comments below and reach out to me or Jessica and tell us what you would want to hear from us next, so that we can keep you all informed and hopefully happy and healthy.
Great.
Thanks.